Hello everyone, welcome to Ask Giri Physio Show Season 5 Episode 2. Today's topic is about Men's Health Series Part 1. We're going to talk about penile rehabilitation after prostate cancer and prostatectomy. What are the common things happens after prostate cancer or prostatectomy in this male pelvic area? Penile disease is very common, where you can also have a little bit of a curvature of the penis after the prostate cancer treatments or also after prostatectomy, and there are different stages of that, and there is various forms of physiotherapy treatments is available for that. Number 2 is your shortening of the penis. Sometimes it can happen as well due to various reasons, and there is physiotherapy approach for that too, to work with strengthening of some of the muscles around that area. And also, do you know that your penis is connected with some ligaments in that area too? How many people know about the ligaments of the penis and the laxity of the ligaments? And you can work on those things as well. The other common things is urinary incontinence. It can also, from various degrees of urinary incontinence can happen. It can happen normally. It can also happen when you have a sexual thoughts. It can happen during orgasm, and that's what we call it as a climacturia. A lot of things can happen after prostate cancer and prostatectomy, which can be also dealt with male pelvic floor physiotherapy. And another thing you will notice is reduced sex drive or libido after the prostate cancer treatments. That is also common. That's when your psychological approach and other mindfulness and other meditation approaches can help you with that as well, along with other stimulatory things. So pelvic floor exercises is just more than Kegels. Don't think Kegel is the only exercise you're going to do for all these things. There are so many different types of pelvic floor muscle exercises we have to do, along with other techniques I'm going to talk about during the penile rehabilitation. The pelvic floor exercises should be functional, it should be relatable, it should be fun and pleasurable, and it has to be individualized for you. That's very, very important. It's not you can go to YouTube and look at an exercise and do it for you. And it should be also easy to do, and it should be equipment free. So these are the main criteria for the pelvic floor muscle exercises to work properly for you for your penile rehabilitation. Two main components of your pelvic floor muscle exercises. Number 1 is position. What position you are doing, it matters. Are you doing in lying position, which is kind of very easy and least effective compared to sitting supported, sitting unsupported, to standing, and also various postures from standing, okay? So you can work on different positions to activate your muscles differently. That is number 1. Number 2 main component is your pelvic floor muscle contractions. What type of contractions? Are you doing sustained contraction? Are you doing fast twitch contractions? Because there are different types of muscle fibers in your pelvic floor muscles. So you need to work on those specifically. Some muscles need sustained contractions, some muscles need short flicker of contractions. So as I talked about the position, when you're lying down and doing these exercises, that activates your pelvic floor muscles, little bit lower activity there, along with your lower rectus abdominis, transverse abdominis, all your core muscle activity also will be a little bit less. Compared to in standing position, your pelvic floor muscle activity will be more, along with your core muscles as well as other pelvic floor muscles as well. So from the physiotherapist perspective, these various positions we call about unloaded position or seated position or semi-loaded position or fully loaded positions. So we teach exercises based on where you're at on these different positions for you to contract and strengthen your pelvic floor muscles, whatever you need for your penile rehabilitation. When we are doing exercises, pelvic floor muscle exercise in different positions, we also focus on different types of contractions. As I told you, two main components of pelvic floor exercises. One is position, another one is type of contractions, right? What are the different types of contractions? We have names for it. Some really funny names in the men's health field. Number 1, we talk about the pumper. What is a pumper contraction? Pumper contraction is nothing but submaximal contraction. It focuses on superficial muscles in your pelvic floor. That's called pumper. And the next type of contraction, we call it as a rocker. What is a rocker? Rocker is to maintain a submaximal contraction with pelvic rotation. We do some pelvic rotational movements, then you do this submaximal pelvic floor contraction. We call that a rocker. And the third type of contraction, we call it as a boner, because we do this submaximal contraction with an erection, right? It can be done during masturbation or doing any sexual stimulation activities. That's why we call this as a boner. The last type of contractions we also teach and practice in pelvic floor health is shooter. What is a shooter? Shooter is nothing but maximum rapid contraction, right? With kind of 1 second intervals. We do that for about 8 to 12 times, right? And the happy endings we call it. So this is called the shooter. So maximum contractions, very rapid contractions with just 1 second intervals. We do it about 8 to 12 times. These are the 4 different types of contractions we teach the patients in 4 different types of positions. It can be unloaded or seated or semi-loaded or fully loaded positions. This is kind of compromises your penile rehabilitation exercises along with the other things we're going to talk about. So how do you choose which exercise is good for this patient? Okay, we select the exercises based on patient's compliance during the history taking and patient's goals, what you want to achieve, very task specific and patient centered, and also patient's comfort limit on a different positions which they are very comfortable in doing these exercises. So based on these factors, we select the appropriate exercise for you. It's tailor-made for you. Another main component in penile rehabilitation is relaxation and breathing. Okay, you should know how to let it go. A lot of men are in sympathetic overdrive most of the time. But do not forget, erection is more of a parasympathetic drive than a sympathetic drive. Your parasympathetic mechanism has to work very, very well. So that's why we focus a lot on relaxation and breathing techniques, especially parasympathetic breathing, very synchronous breathing and mindfulness, along with these other techniques and exercises. Also, to understand the concepts of penile rehabilitation, you have to understand how erections work, right? And how this prostate cancer treatment and prostatectomy affects erection and why it affects erection. Then you should know what are the things to do. After a proper assessment, we will put a treatment plan, then you know exactly what to do, what kind of treatment you need. So how erections work? Erections is all about hydraulics, right? Things go in, things don't come out, then stuff moves up. That's it. That's very simple as it is. So hydraulics are very important function for erection. And also do not forget the parasympathetic nervous system activation is very important. That's why you need to have some peace of mind when you have to have a good erection. You can't be really stressed and try to expect to have good erection. So in line with the anatomy of erection, we talked about it's all hydraulics. Then who are the 3 key players for erection? Number 1 is your nerves. Your nerve plexus, which is coming from your lower back area and sacral area. That's very important for erection. Second one is a muscle. It's a pair of muscles, a pair of tube muscles there. It's called your corposa cavernosa, right? You can see it in the picture here, and that's very important muscle because that's where it swells up during the erection, during increased blood flow. And the good thing is about is arterial blood flow comes in, it increases the girth of that muscle, and the venous backflow stops. Right? You need the stoppage there too to get a good erection, right? That's very important. And the outer covering of those muscles, it's called the tunica albuginea. That's also very important. These are the 3 key players for your erection. So why erection is getting affected during prostate cancer treatments and also prostatectomy? To explain that, I want to show you this slide. Look at that nerves. Look at that yellow colored structure which is coming from your lower spine. See how it's come along your bladder? Then see how close it's coming to your prostate gland. See all those branches going into the prostate gland. What happens when you have radiation therapy in the prostate gland or a prostatectomy surgery, whether it's a partial or radical? So see how these nerves can be affected. These are the nerves important for your erection. So that is why erections can be affected during prostate cancer treatments or prostatectomy. Along with things we have discussed so far, proper assessment and your goals and very important pelvic floor muscle exercises on different positions in different contractions and breathing and relaxation and also patient education. Along with that, there are a lot of evidence coming up now for use of little bit of a low intensity shockwave therapy. Whether it's a focused shockwave or radial shockwave, we use different parameters because your focused shockwave has a better depth of penetration, goes up to 12 centimeters. In radial shockwave, it goes up to about 3 centimeters, right? And we use this on the base of the penis and the shaft of the penis. It's kind of a more restorative, regenerative use, and it also improves your blood vessels, blood flow in that area, and also formation of new blood vessels as well. There is a lot of research out there. I can quote some of the research articles for you to review as well in this so that you can go read by yourself. And low intensity shockwave therapy along with other things might also help for some of the patients. Okay, every approach and every modality is not good for everyone, so we really make tailor-made treatment approaches for you based on your needs. So this is just to kind of gives you a little idea of what involves in the penile rehabilitation after prostate cancer and prostatectomy, and there are much more to do. I don't want to explain in too much detail for you guys. You guys have got an idea how we approach it, and we go from there. And also we do a very thorough examination. We don't have to do a lot of internal work for this rehab. It's mostly all external, a lot of exercise based and modalities based in there with a lot of home exercise program. Hope you got an idea. So if you have any other questions, please reach out to me, Giri Srinivasan, registered physical therapist, host of Ask Giri the Physio Show. This is our season 5 and episode 2. If you want to check out our previous episode, please visit physioshow.ca or also visit our YouTube channel, Ask Giri the Physio Show. If you really like this information, if you want to share with somebody, please like, share and subscribe Ask Giri the Physio Show. Bye.